What can I do if my cat is having trouble breathing? If your cat is experiencing breathing difficulties, also known as dyspnea, it is a serious and potentially life-threatening condition that requires immediate attention. Cats are good at hiding their illnesses, so by the time you notice breathing problems, the situation may already be critical. Understanding the causes, symptoms, and what to do in an emergency can help you act quickly to protect your cat's health. Signs that your cat is having trouble breathing. A cat in respiratory distress may show the following symptoms: open mouth breathing or gasping. Cats typically breathe through their noses. Panting excessively, uncommon in cats unless overheated or stressed. Coughing or wheezing. Labored breathing with heaving sides. Blue or pale gums, cyanosis, indicating a lack of oxygen. Extended neck or head held low to improve airflow. Noisy breathing or crackling sounds in the lungs. Lethargy or weakness due to lack of oxygen. If you observe any of these symptoms, seek emergency veterinary care immediately. Possible causes of breathing problems in cats. Several conditions can cause difficulty breathing in cats, including asthma, a common condition in cats causing wheezing and shortness of breath. Heart disease, conditions like congestive heart failure can cause fluid buildup in the lungs. Respiratory infections, viral or bacterial infections can lead to pneumonia and labored breathing. Obstructions, foreign objects in the airway can restrict breathing. Pleural effusion, fluid buildup around the lungs can cause severe breathing distress. Lung disease or cancer, tumors or chronic diseases can make breathing difficult. Trauma, injuries, such as being hit by a car or falling from a height, can cause lung damage. Allergic reactions, severe allergies can trigger swelling in the airways. Immediate actions to take. If your cat is struggling to breathe, follow these steps. 1. Stay calm and keep your cat calm. Stress can make breathing problems worse. Keep your cat in a quiet, comfortable space with minimal disturbances. 2. Check for visible obstructions. If you suspect choking, do a quick mouth check for foreign objects. Never attempt to remove something deep in the throat, as it could worsen the situation. 3. Avoid forcing your cat to move. Carrying or restraining your cat too much can cause additional distress. Instead, let them stay in a comfortable position that allows easier breathing. 4. Provide fresh air or humidified air. If your cat has asthma or a respiratory infection, steam from a humidifier or a steamy bathroom can help open airways. Ensure proper ventilation, but avoid strong fans or air blowing directly at them. 5. Do not give any medication without veterinary approval. Human medications, including over-the-counter drugs, can be toxic to cats. Only administer medicine prescribed by a veterinarian. 6. Seek veterinary help immediately. If your cat is open-mouth breathing, gasping, or has blue gums, take them to an emergency vet clinic immediately. If transport is necessary, keep your cat calm and in a well-ventilated carrier. Veterinary diagnosis and treatment. Once at the vet, they will assess your cat using oxygen therapy if your cat is in severe distress. X-rays or ultrasounds to check for lung conditions or heart disease. Blood tests to diagnose infections, inflammation, or anemia. Fluid drainage if pleural effusion, fluid around the lungs, is present. Medications like steroids or bronchodilators for asthma or allergic reactions. Antibiotics or antivirals for respiratory infections. How to prevent breathing problems in cats. While some respiratory issues are unavoidable, you can reduce the risk by keeping your cat indoors to prevent infections, allergens, and trauma. Avoiding smoke exposure, including cigarette smoke and air pollutants. Using dust-free litter to prevent airway irritation. Monitoring for early signs of illness and visiting the vet regularly. Managing asthma with prescribed medications and avoiding triggers. Final thoughts. Breathing difficulties in cats should always be treated as an emergency. If your cat shows signs of distress, act quickly, keep them calm, and seek veterinary care immediately. Prompt action can save your cat's life and ensure they receive the right treatment. Even if symptoms improve temporarily, always consult a vet to determine the underlying cause and prevent future episodes.